All right, here we have Evelyn, and she came to us about a month ago. She had some degenerative disc disease in her spine, and you had some radicular pain down your arm, and we decided to do some laser stem cell signaling in about the C5-6 disc and nerve area, the cervical nerve root to C5-6 going down your arm.
Yep.
And 1 month later, how are you doing after the stem cells we did?
Much better. It's intermittent.
Uh-huh.
I do wake up at night with the pain in my left arm and hand,
Okay.
but it is not as severe.
Okay.
And I had to take a half a Norco and some heating pad to be able to go back to sleep.
Uh-huh.
My low back and left hip only hurts at night also. It's better if I keep moving. So I try to keep moving. I had a trainer
Uh-huh.
to show me some core strengthening. And honestly, I felt he was like a kid. He was really good and probably well-trained, but I don't think he knows about elderly. Like, you can't stand on one leg holding a single pole and swinging one leg around in circles.
No, not yet.
All over.
Yeah.
Anyway, I'm not doing exercises yet, except for walking with my dogs this morning, and and I have house guests, and I just did laundry with a housekeeper, 3 beds.
And you were actually scheduled to get an epidural in your neck, correct?
I was scheduled.
Well, it looks like we don't have to do that. So how many % better does your neck and arm feel 1 month after the procedure?
It feels 80% better.
That's amazing. And it's only been a month.
And it's intermittent. Like now, today I had nothing.
That's amazing.
Until I held my phone and iPad too long, and my left arm started to go to sleep again. But
yeah, let's use your right arm and never bend your neck to look at your phone. Always put your arm like this, and your phone like this. That way it's at the level of your neck. See that? Yeah, because when you're like this, it compresses your nerve, and that could be causing the pain. So I'm really surprised you made some fast results in only a month. Remember I told you normally with nerve issues and disc issues, you get about 10% improvement a month. So you're making 8 months of result in just 1 month. That's amazing.
Well, as I said, it's intermittent.
Yeah.
I have moments when I feel like I'm 30 again. And then I have those moments always during the night when it's like, oh crap, here we go. But it's not, it's intermittent.
Yeah, like I said, you've had this pain for how long? You've had the neck and arm issues for how long?
Well, I had the neck a long time. Dr. Erlandson tried the cervical epidural, couldn't get in between. That was, before my husband died, which is 8 years ago.
Yeah, and they kind of, it sounded like they didn't get the right spot. They hit a bone or something and it didn't work, right?
Well, he said, yes, his wife is his nurse, and I heard him. My husband is on the board at Eisenhower.
Yeah.
And I'm a member of 24/7, which is wonderful. You get the best of care. You help the hospital and they help you.
Now, were you told if the epidurals failed, you'd be looking at some type of cervical disc surgery?
No.
Good.
You know Dr. Hirschberg?
I've heard of him, yeah.
Joel Hirschberg. He's actually a rheumatologist, and he used to take patients. And he told me the other day, because I told, and do you know Coyle?
No.
Coyle is a cardiologist.
Okay.
And I had my yearly checkup there. And I told Coyle what I'm doing. And he said, be careful, check the records, because there's a lot of charlatans out there.
There are.
And I said, I know, and I've studied. And I looked at his books and I went online, and I know George Bush and Laura Bush from political things and
Yeah.
stuff. And I did check, trust me. And he said, look at my drugs. And he said, you're 86 years old. You have no sign of cardiovascular disease, stroke, or anything. So stop the Atropine or, Lipitor.
Yeah. You don't need the statins. Yeah.
I don't need the statins. And I also stopped the Celebrex.
Yeah. And now I think we could stop the gabapentin because your nerves are better. And then looks like you could give a good report to him because you're doing fantastic. All right.
Thank you.
Yeah.
Well, I'm trying, and I thought if you're going to take a step, you have to do what they say and do your best to follow protocol. Otherwise, why did you go in the first place?
Absolutely. And if other measures failed, short of surgery, obviously it's worth a try. And obviously it worked out for you. 80% better in 1 month. That's fantastic. Okay. So Evelyn, we're going to do a little laser and shockwave on your neck to keep the cells stimulated. And we'll have you back in a couple months for another checkup. Okay.
Yeah. Okay.
All right. Congratulations. I'm glad you have a good report. Okay.
I did. And as I said, it's unpredictable and it's intermittent. And if I have trouble, I just get up and I took a half a Norco last night and use the heating pad.
Good.
Because the 2 Tylenol when I go to bed, it's just kind of, a little bit. And
Yeah. Well, it looks like eventually we could get you off that totally because, you're just going to get incrementally better. Okay. All right.
I got to get better fast.
You are. And that's why we're going to add the stem cell machine today, the shockwave. It'll stimulate the cells even more. Okay.
Okay.
All right, Evelyn, we'll get that shockwave treatment and we'll see you in a couple months. Okay.
Okay.
All right. Bye-bye.
All right. Then happy Thanksgiving.
You too. And I'm glad it's working out.
Thank you.
All right.